if you know what I'm talking about, metabolic acidosis, metabolic alkalosis. Those are the ones that we will dedicate our time the next, I don't know, the next time. But today we'll just cover the two of the most, well, some of the most common cause of potassium disorder. And remember, I will not go in depth into it because it's too much to talk about. Potassium. Normally, when we have an issue with potassium, we just go ahead and treat it, and we don't worry about the cost that much. So, but you will be surprised. There's some very common cause out there that that patient uh, without lacking of physician education, they don't know what they're doing. So, okay, and correcting potassium is important because if you don't correct potassium, you will have arrhythmia and you may die. Okay, so it's very important to correct potassium, and usually if we correct potassium, we usually correct the acid-base status as well. So that's why we will have a separate topic talk on acid-base in the future. All right, let's start first case. So someone read the case. I will ask our new people to do that. Let's ask. Let's say, Lynn, can you read the case, please?
56-year-old Americans presented to the emergency department with a 2-day history of progressive dyspnea and wheezing. He has a history of asthma. First stayed at his home. Inhalers were not adequately controlling his symptoms, despite a substantial increase of frequency of use. He also has a history of hypertension and ischemic heart failure, secondary to an acute myocardial infarction he suffered. His medication include albuterol, medications, aspirin, lisinopril, furosemide, labetalol, and pravastatin. On the physical examination, his temperature is 37.3 Farenheit to 92 Celsius. Respiratory rate is 30 and blood pressure is 134 per 92. Collateral raising and increased growth of breathing was not on examination. Chest X-ray reveals no area of consolidation of or masses. Cardiac monitor reveals flattening of T waves. Which of the following is no likely cause of the finding on his monitor? Uh, so we need
Read the
this
answer as well. Yeah.
Venous finding in patients with asthma. B. Medication side effects. C. Presentation of another condition. D. Progression of his acute illness. E. Severe of his previous myocardial infarction. This somewhere maybe I have missed it.
Sequela, yeah, the last word, sequela.
Sequela is like the consequences, something
Yes.
like that.
Yes.
So, as I always say, today I don't have control of my pen, so I will ask Miss Dr. Toon to highlight stuff for me. As I always talk to my friends in this case talk, what important? First of all, what's important? What's the question asking first? I always look at the question first. Okay? Because in the future, when you guys become a physician, you want to, when you got a consult from someone, you want to answer their question first. Okay? So look at the question is important. So what's the question? What are we trying to find here? What are we trying to answer?
What some abnormal symptoms or some point make you think like this can help you to answer the question here?
So is the question asking us to treat, or is the question asking us to find the cause, or is the question asking us what's the sign and symptom of what? So what's the question is asking about? The question asking about cause, right? So the question is asking your explanation on the finding of the monitor that the cardiac monitor review. So if you know your stuff, you should already have the answer without even looking at the whole long stems. Because if this was a board question, then you should have the answer right away. But let's look at it. So what's on the monitor?
The monitor review flatten of T wave.
So flatten of T waves. So what do you know about flattening of T wave?
Flattened T wave is the sign of hypokalemia.
Good, hypokalemia. Okay, what about the hyperkalemia sign?
Hyperkalemia is review high peak T wave.
Okay, good. Peak T wave. Good. Okay, so flattening of T wave. So which before we analyze the stem, do you know what answers? Well, technically, the answer doesn't really tell us much. So let's just look at the stem for now. Where is the thing, Thương? Okay, how old is well, sign and symptoms again. Sign and symptoms. So, Vâng, what do you think is important in this case that we should notice?
I think that we should notice in some point like a 2-day history of progressive dyspnea and
Okay, 2-day history. So is this acute or chronic?
It's acute.
It's acute problem. Good. Take note of that. It's an acute problem.
He has history of asthma.
History of asthma.
Yeah.
Good. That's important. Well, I don't know how important, but we figure it out. So if he has a history of asthma, you want to know if he's using his inhaler, or you want to know if he's using it correctly and how often he uses it. So is he using an inhaler?
Yes, he using inhalers at his
Okay. Okay, but is the inhaler helping him at all?
But it can help him to control the symptoms.
Okay, cool. So it's not helping at all. All right.
Besides, he has hypertension and ischemic heart failure secondary.
Okay, so he also have hypertension and ischemic heart failure. Okay, that may play a part. Good. What else? What else that he on? What else is important? Let me ask. To say what else do you think is important?
He is using furosemide, so
he's using a lot of stuff.
Yes, furosemide.
Albuterol, furosemide, labetalol, pravastatin. All right. Seems like this guy on the bunches of medication. This is very common in America. I don't know about U.S. I don't know about Vietnam, but in U.S., whenever the patient present to me, they have a whole page, maybe 2 pages of medication list. And my job is to figure out what medication is causing his symptoms, and it seems like everything causing his symptoms. Okay. So this is actually a real case. It's not a fake case that I make up. This is a real case that I see in the ICU. Okay. Patient's currently doing better. He get off the vent last week, so So what else is important? Physical exam is important. Is that important?
Yes.
Respiratory rate.
Respiratory rate is
Respiratory rate.
what?
30.
30.
Pulse is 92. Temperature.
What else? What else is what about his physical? What about his heart and lung sounds? Is it normal?
That's bilateral vision and
Okay, bilateral wheezing. Okay, that's probably from his asthma. And chest X-ray is normal.
Yeah.
Yeah, normal. Chest X-ray is normal.
Cool. So what do you guys think?
can I ask you some question? Did he
Yes.
use his inhaler?
So he's using his inhaler, but it's not adequate control. So it means that it's not helping him at all.
So, but what amount that he using? Like, did he actually use beta adrenergic or something?
I think he, well, on his history that I collect, he say that he use it every night, and when he has his, so he uses every night. So his asthma probably turned bad. But a few months ago, he only used it once a week, but now he's using it like almost every night. And I forgot to put it in here, but he got the 50-pack year of smoking history. And he on aspirin with asthma. And do you know the triad of aspirin? Aspirin, asthma, and nasal polyps. Well, that's just a side note information. Usually if the patient have asthma and they're on aspirin, usually most likely if you stop the aspirin, they will stop the asthma exacerbation, because usually they go together. But
It means like the aspirin can induce asthma.
yeah, NSAID
Yes.
induce.
Induce asthma. So when you cut aspirin, the asthma will be reduced.
Okay, so what you guys think? Was that the benign finding in patient with asthma? Do you think this is benign finding that he got hypokalemia?
No.
No. Why? Why not?
Because I think it's this side effects of the medication.
Yes. Well, your answer is correct. But I just want to find out why the other answer is not correct. So, well, if it says right, it's a medication side effects, because he on a lot of medications, and if you know about the mechanism of all of them, you should be able to figure out why he got hypokalemia. Okay. So A is not correct, because patient with asthma usually not present with hypokalemia. They will present with hypercapnia instead, high PCO2. Okay, because asthma is a reactive airway disease. It's a COPD type, and it's caused air trapping. So usually you will see, but we don't really have any evidence to tell if it's a benign finding, so we can rule out that answer. C, presented with other conditions. Ischemic heart disease and hypertension can cause hyperkalemia, but it will have a lot of other findings as well. And his chest X-ray revealed no consolidation on masses, which means there's no pulmonary edema. That tell you that, hey, his hypertension is not bad, or his ischemic heart disease not bad. Plus, he already controlled his ischemic heart disease by statin. So I think his hypertension is well controlled, because his blood pressure is in the normal range. Okay, so it's probably not from hypertension or heart failure. You guys forgot to highlight the blood pressure. Can you highlight blood pressure? Yeah. See that? It's normal blood pressure. And chest X-ray normal, so no heart failure or anything. Cool. Progression of his acute illness. Well, if you from asthma, if you have asthma and it's the very same answer as A, because asthma usually don't cause hypokalemia. Okay, so we can rule out that answer as well. And E, consequences of his MI. Well, you know what the consequences of MI, it will cause, usually if the MI is real bad, it will lead to heart failure. The sequence of the MI usually will cause heart failure or some kind of mitral valve regurgitation or some valve problem. And if we see like heart failure or valve problem, the chest X-ray will reveal pulmonary edema. Okay, so E is not a correct answer. So let us with B. He on a lot of medication. So now I'm going to ask you a pharmacology question. Which of those medications cause hypokalemia?
That's adrenaline, furosemide.
Furosemide do cause it. What else?
Albuterol.
Albuterol also cause it. What else?
Labetalol.
Labetalol also cause it. Okay. What else? Do you think fluticasone can cause it? Yes, it can also cause hypokalemia, but in rare cases. Okay. Lisinopril actually cause what?
Hyperkalemia.
Hyperkalemia. Okay. Cool. Good. Albuterol and labetalol is a beta agonist. Okay.
Yes, beta agonist.
Beta agonists cause hypokalemia and also cause what in diabetes patients? Actually, beta 2 agonists can cause hypokalemia. Okay. And labetalol is a beta antagonist. So labetalol should not cause
Hypokalemia.
but albuterol does it. Okay. So when patients have asthma and they put on albuterol, usually we advise them, hey, you need to somehow control your potassium level, because if you use albuterol a lot, like if you use your inhaler a lot, you may have hypokalemia. Okay. And you're right, flattening of T wave is a sign of hypokalemia, and if we don't treat it, it's bad. Okay, so how do we treat hypokalemia?
Using potassium chloride.
Yeah, just give them potassium.
Potassium. Oh, yeah.
That's simple, right?
Medication.
Say what?
First, we should stop the medication.
Yes, stop medication. Yes. That's a good thing.
Sure.
That's the first thing you should do.
Yeah.
Okay. Because we don't know what medication may cause what. Just stop all the medication and see if they get better in a day or two. Okay, and then we start to correct the symptoms. But let's say that we already stopped the medication. How do we treat the potassium?
How do we use? How we manage the patient?
Yeah, how do we manage the potassium? Do we just give potassium?
We use potassium chloride?
Yeah, we just give potassium. That's all I ask, right? There's nothing
Yeah.
hard. Treating hyperkalemia is harder, but treating hypokalemia is easy. Just give potassium. Okay? Cool. This is the real case, this guy. Patient getting better already, which is a good thing. See? And it's a very common cause that people on albuterol inhaler because people have COPD when they smoke all the time. And I don't know about Vietnam population. Well, Vietnam definitely have a lot of smokers, but I don't know how much asthma patient that you guys diagnose each year, but every day I see at least like 5 or 6 asthma patients. Okay, and sometimes they don't even have asthma. You know what they have? Obesity. And you know what obesity can cause? Hypoventilation. Okay.
Apnea.
Yeah. Hypoventilation, and that can prompt them to use the inhaler. Okay, because they can't breathe, they have to use the inhaler. And when they use the inhaler, they check up their potassium and their electrolyte. Simple. Patient may not have no past medical history of electrolyte disorder. They just have obesity. And best treatment for obesity is, hey, go lose weight.
No, it's hard.
Yeah, not everybody can do that, I know.
Yeah.
I tell them, hey, go lose weight all the time. Next time they come back, increase their weight. I ask them, what do you eat? It's like, oh, nothing, just regular food. I say, okay, yeah, you need to change somehow. You need to eat something better. All right, let's move on to the next case.